Mesothelioma life expectancy stage 1 is not good. It takes so many years to develop symptoms that are severe enough to even think of going to doctors and taking imaging tests, that this disease is almost impossible to cure. Even when you notice the symptoms, it is easy to misdiagnose what you have. That cough, fatigue, fever, and chest pain can be any number of lesser illnesses, but if you've worked with asbestos in the past, get it checked when you first notice. Mesothelioma is usually diagnosed after age 60. This form of cancer is usually diagnosed after the age of 60, or well into the retirement years. And at that age, when you develop a chronic cough, you are more inclined to assume it is asthma, allergies, or emphysema. Life expectancy for mesothelioma is short, often less than 6 months, and rarely longer than a year. However, there are exceptions, and new treatments and testing methods are in clinical trials at this time. Pleural mesothelioma, the only one with set stages. Only one form of mesothelioma has set stages, and that is pleural mesothelioma. There are basically 4 stages. In the first stage, the cancer has only affected one layer of the pleura. When it has invaded both layers on one side of the body, it becomes stage 2. When it spreads to the chest wall and the lymph nodes on one side of the body, it is in stage 3. Stage 4 has the cancer metastasizing to other organs and the bones on both sides of the body. Are your cancer cells epithelioid? If you have mesothelioma, your life expectancy is slightly better if your cancer cells are epithelioid, which is the most easily treated of these cancers. Sarcomatoid cells are more resistant to treatment and are far more aggressive. The third type is called biphasic, and is a mix of both types of cell. Check out aggressive chemotherapy procedures. There are doctors who are using very aggressive chemotherapy procedures, in order to increase the length of survival time to allow for surgery. In other cases, surgery is performed first and then hyperthermic intraperitoneal chemotherapy is used. In this method, the medication is delivered directly into the cancerous area by means of a shunt. This method shows great promise, if the patient qualifies for this type of treatment. When reviewing 300 cases, the results were hopeful for mesothelioma life expectancy stage 1. 0.75% survived for a year, and of those 50% survived for 5 years. Early detection is key with this cancer. So what else affects the survival rate with this disease? Because this cancer is latent, detection time is of number 1 importance. How old the patient is seems to have a bearing on it. Which type of mesothelioma the patient has contracted will matter. Smoking will decrease mesothelioma life expectancy greatly. The patient must quit smoking immediately in order to have any quality of life. I can't go into all of the information that's available about mesothelioma life expectancy stage 1 as it varies from patient to patient. For more information on mesothelioma life expectancy stage 1, click link below.